Next, we'd like to invite Dr. Dorota Jarosinska. She is a specialist in public health, working for nearly 30 years on the health and environmental issues at the WHO European Center for Environmental and Health in Bonn, Germany. She manages a program on living and working environments, which covers topics of air quality and health, health aspects of climate change mitigation, chemical safety, environmentally sustainable health system, environmental noise, and occupational health. She's a chair of the Joint Task Force on the Health Aspects of Air Pollution under the UNC CLRTAP. She coordinated the project on the development of WHO Global Air Quality Guidelines, which were published in September 2021, last year. So please, Dr. Jarosinska, floor is yours.
Thank you very much, Mr. Chair. I hope you can hear me well.
Yes.
Thanks a lot and good day, ladies and gentlemen. Thank you very much for this kind invitation to speak about the activities of the Task Force on Health. And we have heard the introduction from the Air Convention and also other aspects of WHO work on air quality and health, because these things are very closely interrelated. So I'm representing WHO European region, and in particular the European Center for Environment and Health. And our activities under the umbrella of the task force and of WHO, they really cover a wide range of efforts to support member states in their work to improve air quality and to protect health. That is analysis, assessment, and consolidation of the scientific evidence, but also development of different methods and tools so that the health argument is really brought to the forefront of the discussions and policies and actions also in other sectors. This work is guided by a number of policy frameworks, and I will just mention few of them coming from the WHO. The really prominent was the resolution of the World Health Assembly in 2015, where ministers of health really acknowledged air pollution as a public health issue. This is also part of the general program of work of WHO. There is a global strategy on health, environment, and climate change. And I would like to also mention a specific process in Europe, which is very important for our activities as WHO Center and the task force, which is a multi-sectorial process involving 53 member states of the WHO European region, called Environment and Health Process. These are representatives of the Ministries of Health and Environment who are identifying regional priority issues related to environment and health. And the process was launched in 1989. And by the way, at the first ministerial conference, the decision to establish a European Center for Environment and Health was made. And then there were subsequent conferences. And the point I want to make is that, not surprisingly, air pollution and the need to work to improve air quality to protect health has been featuring prominently and continues to be one of the regional priorities. So this is the context, this is the environment also in which the Task Force on Health is functioning. We have already seen this image. I just would like to remind ourselves that we are part of the working group of effects. And the Task Force on Health was established already in 1998. So this is really a major achievement to have a well-established, sustainable, intersectorial platform where representatives of the parties to the convention, coming both from the health and environmental side, can meet and discuss. From the very beginning, this task force was chaired by WHO European Center for Environment and Health. The members of this task force are designated by the parties. These are parties, countries, but also the entities like the European Commission. And the way how the task force works is that there are annual meetings, and there is also, of course, a component of the implementation of the task force work plan, and I will give few examples in a minute. This is really a valuable model of bringing the health community, the health argumentation into the originally environmental convention, which creates really a unique opportunity to identify and to discuss problems relevant for both environmental and health community. So the main role, the main activities of the task force is, of course, to provide assessments of the health effects of air pollution and to provide documentation to the executive body of the convention, to make an effort to quantify and to assess the contribution of long-range transboundary air pollution to human health, but also to be part of the discussion when it comes to setting priorities for future activities, and to also provide methodological advice when it comes to the quality of the assessments, especially of the health impacts of air pollution. And over these 25 years, a number of documents, assessments of the evidence has been produced. There was a very substantial piece of work in the early 2000, looking into the aspects of long-range transboundary air pollution and health risks related to different groups of pollutants, ozone, particulate matter, heavy metals, etc. In the course of the last 10 years, just to give few examples, in 2012, there was a report building on the systematic review of evidence on the health effects of black carbon, also in the context of the Gothenburg Protocol. In 2015, we published a technical document looking into both scientific evidence and policy options related to the residential heating with wood and coal, still very common in the region covered by the convention. And the document is now 7 years old, but this topic is coming, I would say, back with quite big prominence, also in the light of the current energy crisis in Europe. And last but not least, the very recent report, which is a product of the task force. This report was released in December 21 on human health effects of PAHs in ambient air, looking both into the carcinogenic and non-carcinogenic health effects. And this was a product of the work, product of the task force, developed by the working group composed of the representatives of 6 parties to the convention, presented to the task force, discussed. So this is just to give a flavor of what are the products of the task force. Speaking about reports, assessing, evaluating the evidence, I would also like to say a few words about our major piece of work, which was not solely or explicitly the product of the task force, but where the evidence was presented to the task force and is, of course, also very relevant for the future activities, which is the Global Air Quality Guidelines, a piece of normative work of WHO with a very important role also in policy making at the global level. So the guidelines, as such, they are not legally binding standards, but they are robust recommendations related to air quality to be protective to human health. They are intended for the global use and meant and intended as a tool to inform policy making. And they have been developed through a very rigorous process involving a very comprehensive assessment of the available evidence. And in addition to the document, which is available on the WHO website, you might be interested to learn that the systematic reviews of the evidence, which were underpinning the development of the guidelines, are also published in a peer-reviewed journal, and they are used and they are accessible to many users, and they are also a basis of some activities of the task force that I will mention in a minute. I believe that many of participants might have already seen the air quality guidelines and the values. I will not go into the details, but just would like to say that the document, the air quality guidelines, they contain the numerical values of air quality guideline levels for the selected pollutants, which are of prime health concern, so particulate matter, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide. In addition to these air quality guideline levels, which one could say is the ultimate value to best protect public health, there are so-called interim targets, and these are the values of air quality levels for these pollutants, which are intended to help member states to take gradual steps to improve air quality, because it is apparent that these air quality guideline levels, they are very demanding if you compare it with the reality in many countries, in many parts of the world. Therefore, to facilitate this gradual improvement of air quality towards achieving this ultimate goal, these interim targets are very helpful. And a very new feature, which is present in the guidelines, are qualitative so-called good practice statements. Because for several types of particulate matter, like ultrafine particles, black and elemental carbon, sand and desert dust, there is a growing interest and, I would say, demand from the community of professionals to get some guidance how to deal with them, also from the health perspective, because there is body of research pointing to their health relevant. And it wasn't feasible because of the insufficient quantitative evidence to derive any numerical values. However, the document provides some guidance related to monitoring, already feasible mitigation measures, and further research in those types of air pollution. So the question in the context of this session of the use of this evidence and recommendations in the policy arena, it is mainly to develop legislation standards related to air quality, ultimately aiming at decreasing the current huge disease burden due to air pollution. There is also a very important aspect that air quality guidelines may also be used as a prompter, as a strong argument to facilitate climate action, since climate change mitigation measures are also, of course, very relevant to reducing air pollution. And from the health perspective, there are many co-benefits. And there is also a component of stimulating further research. And just to illustrate from the European perspective, the guidelines have already been used as this evidence-informed reference to developed policies in the European Union in the process of revising the Ambient Air Quality Directive. And in fact, it's just last week on 26th of October, where a proposal for a new revised directive on ambient air quality has been presented, referring explicitly to these new air quality guidelines. This work on air quality guidelines as a document, as the evidence review and the basis for actions also in the policy domain, is presented also to the task force, because beyond the European Union, the air quality guidelines and other evidence reviews, they are being taken up by policy discussions in individual member states. And getting back to the activities of the task force, a forum to present this and to discuss are the annual meetings of the task force. In general, the meetings of the task force are the opportunity to present updates on international policies and processes from the Air Convention, from the European Commission, from individual member states. Also, to give an update of the progress in research of air pollution. Also, to present more pragmatic tools and advances in the methodological work. And an important component is also around public health messaging and communication of the health messages related to air pollution. This is also an opportunity to talk about the implementation of the work plan of the task force, and when the time comes also to discuss plans when the new work plan is to be developed. And all the meeting reports from the task force gatherings are available on the WHO and also on the Air Convention websites. I would like now to give a few examples from the current task force work plan to give a flavor of what we are discussing and what we are working on, where also the elements of the WHO work on air quality and health are brought to the attention and are picked up by the task force. So our work plan is, of course, part of the work plan of the working group on effects. And now, following the publication of the guidelines, the work continues around consolidation of the scientific evidence on the health outcomes of exposure to air pollution. And one of the tasks of TFH for this ongoing biennium is to work on the methods for the health risk and health impact assessment of air pollution and cost effectiveness analysis. This is a very important tool for the community of practitioners that are advising also on the policy side. And in 2013, a project called RAPI, so Health Risk Assessment Instruments, a series of concentration response functions for specific pollutants and specific health endpoints, was provided. It was in 2013. Given the progress in science and especially the work done for the guidelines and the evidence systematically reviewed and published, as I have shown a while ago, was a prompter to look into this and to undertake the work to revise and update a set of these concentration response functions that might be used for health impact assessments for Europe. This project focuses on mortality. And here I would like to come back to this piece of discussion between Professor Ueda and Professor Kliman following a presentation of Professor Ueda of the relevance on morbidity assessments. This is really a huge issue. It was mentioned in the project, RAPI project in 2013. It is now partly a project of this RAPI update, but there is a dedicated activity coordinated by WHO colleagues in Geneva called EMAPEC, a project which really looks in particular into morbidity in relation to air pollution. Still, these massive challenges remain. On one hand, this what was mentioned earlier today about the accessibility and availability and accessibility of this data, but also a big challenge in the basic definitions. When there is now a look into the published evidence, the clear distinction between incidence, prevalence, it remains an issue. The very definitions, for example, on restricted activity days, how this is defined, how to refer to it. So morbidity, I would say, the challenges are as big as the need and demand for getting them. So it's really great to hear this also in the presentation of Professor Ueda, because these input signals coming from different parts of the world are really needed to provide advice and the guidance how to improve it so that we get these more subtle assessments more reliable. Another example of the work of the task force is the work on the tools. So very practical instruments that help to quantify the health impacts of air pollution, which member states can then use in bringing forward the health argumentation. In this context, I would like to mention two tools. One called AirQ Plus, which was presented and launched at the task force meeting in 2016. It's a tool that allows quantification of the health impact of air pollution at the different levels, national, but also subnational. This is a tool which got a lot of interest and is very widely used in member states in the European region and globally. And excuse me, it has been shown as a very really user-friendly instrument that allows experts from both from public health and environment to conduct these quantifications of the health impacts. I am mentioning another tool called Climate Age, which we expect to launch by the end of this year. This is a tool which is quantifying both the health and economic aspects of climate change mitigation, reduction of greenhouse gases through improvement of air quality. I mention it because this dimension of considering climate change mitigation, I would say relevance to this discussion also in the task force on health, it is something relatively new, and we see it from the discussions at the task force that over the years this interest is growing and it is now explicitly included in the work plan. So bringing this consideration is also quite timely. And finally, the very last point I would like to make is the activities related to formulation of the health messages related to air pollution, communication, discussion about, for example, air quality indices and their health relevance, and also activities related to information about some personal actions that can be taken to protect from air pollution, as one of the activities where there is a lot of public interest. This work is ongoing, and capacity building activities heavily hindered by in the times of the COVID pandemic, which we are hoping to establish in the coming year. So with this presentation of the activities under the work plan, I just wanted to give some insight into what are the topics being discussed and are subject of work of the task force. And with this, I would like to thank you very much for your attention.